My name's Bill Evans and I'm the co-chair of this conference From Volume to Value. And I work at a company, I was a founder of a company here in San Francisco called Bridge Design, which is now part of the Zymedica family of companies. And I myself actually have lived and worked in San Francisco now for almost 30 years. In setting up the conference, what I wanted to do was get more clinicians' voices into the discussion with designers. As designers, of course, we're very good at talking amongst ourselves, and it's quite hard to get clinicians to more generally engage with us. So the first thing I did in setting up this conference was to get Aina Sawyer, my co-host, involved, and a co-sponsorship with UCSF, which is a great teaching institution with its wonderful Mission Bay Conference Center here. And we chose the theme of the conference, which is From Volume to Value. And we chose that partly because it's a slightly contentious thing to say, certainly to the medical profession, because they think of themselves, of course, as being totally focused on providing value. But I also chose it to throw the gauntlet down to the design profession about what that means to us and what we might have to change in terms of value. And the purpose of the conference really was to bring these two different perspectives together. And here at Mission Bay, we brought together almost 50% of the speakers who were from the clinician and research side of things. So we had designers talking, clinicians talking to each other, talking about collaboration, talking to better understand what value means to each of us, and from that, learn to perhaps better collaborate in the future around the things that are going to impact the future of healthcare. Well, this is a very exciting time to be a designer or an innovator in healthcare, because we have an amazing confluence of events coming together which are causing change in this industry. As a nation, we spend about 18% of GDP on healthcare, which is an enormous number, much higher than most countries in the world. And so we have tremendous cost pressure joining with very interesting disruptive technologies coming from the tech and consumer world, particularly, and also the explosion of informatics. And there's a great white hope that bringing together these different technologies, some personal, some used in these institutions, by bringing these together, we can really impact both the outcomes and the quality of life for people, both in terms of the way patients are going to live with disease, as well as the way clinicians and their support staff are going to support that disease. So it is indeed an exciting time, and we're going through a lot of disruptive change, driven by the same things that have been disrupting things like, with things like Uber and so on, and autonomous vehicles. So it really is a confluence of these things that are making it a great time. So in thinking about the success of this particular conference, I think it's really a continuation of a building dialogue and an appreciation of the value that designers and design thinking and user-centered design brings to the process, whilst at the same time having designers better appreciate how we need to better understand clinicians. So I think it's been a wonderful two-way street, and I really hope it's a continuation and a building of this appreciation between our two professions that's been growing now for about 20 years. So I look forward to seeing more events like this, perhaps put on by other people, other combinations of groups, which try and bring these different types of thinking together and different ways of understanding each other and what value means and how that can be measured.